Welcome to our weekly Next Chapter group. We have William Yan from Duke University. He's going to be talking about neuroinflammation and dermatomyositis, and it's going to be interesting, so stay tuned. Thank you, William.
Thank you, Miss Buell. My name is William. I'm a senior at Duke, and today we're looking at neuroinflammation and dermatomyositis. Okay, so what is neuroinflammation? It is pretty self-explanatory. It is the inflammation response in the brain or the spinal cord, and prolonged inflammation can cause damages in the neurons. There are actually two main types, or at least the famous ones. One is called encephalitis, which means the brain tissue inflammation, and meningitis, which is the inflammation in the brain or spinal cord membranes, which is called the meninges. And common causes include viruses, bacteria, and a lot of the times also
Yes.
autoimmune
Put it on.
disorders. TBI is a cause for that, and there's also like unknown factors included. Um, in terms of symptoms, commonly it's headaches, confusion, seizures, fatigue, memory issues, etc. Uh, Brain injury, not only the big ones, but also the mild ones, can trigger immune response, which can lead to neuroinflammation, and this can last for a very long period of time, which will affect the neuro injuries and recoveries. So moving on to the prevalence of that, neuroinflammation is actually considered a hallmark of both acute and chronic TBI. Um, and it does have a long duration. Studies have shown that neuroinflammation can persist for months to years. And I've also read a paper for like postmortem studies, like after people pass away and the researchers dissect their brains, and they can still see like traces and proteins from neuroinflammation in the brain that persist even postmortemly. So it is very persistent. It is associated with long-lasting impairment in physical, cognitive, behavioral, and social performances. And this inflammation also leads to developing neurodegenerative diseases such as Alzheimer's, Parkinson's, ASLs, things like that. Okay, so before we dive into like the actual cause, I want to first talk about what is inflammation, just a brief picture. So that's inflammation is body's first response to the injury. Um, when we talk about inflammation, it normally has like a negative connotation, but it is actually designed in the evolution to help us respond to whatever viruses or pathogens that's attacking us. So it is overall like a positive process if it is used correctly. So particularly in the immune response, refers to the innate immune response, which allows us to act quickly and protect the body and kind of just engulf the pathogens. So the purpose of that is to kill and normalize harmful invaders, to clear damaged cells, and to start the healing process. However, once this inflammation goes for a long time, this prolonged inflammation can cause damage to healthy tissue. So it is like when you make a warrior so strong that it starts to attack its own people, then that becomes bad. And some examples like that is like allergy. You're identifying something that's perfectly fine to you, like peanut, as a foreign invader. So it starts attacking your own cells, and that causes a lot of problems. And another example would be some autoimmune related neuroinflammations, which is one of the common complications of TBI. So, and then I want to just briefly introduce the innate immune system that plays a role in the brain inflammation. So, microglia is the brain's immune cells. So, they are the resident cells, so they live in the brain, and their main purpose is to kind of survey around and look for pathogens and kill them. And there's also macrophages and monocytes, and what we call them is we call them infiltrating immune cells. So they don't live in the brains, they live in the blood. They are circulating around the blood, and when needed, these cells can infiltrate into the brain and help clear up the debris and fight pathogens. Um, and these cells actually talk to each other with molecular signals such as cytokine and chemokines. Okay, so now I'm going to move on to how TBI can lead to brain inflammation. So research has shown that a big cause of that is the blood-brain barrier disruption. So brain is a very, very important part of our body, and so during millions of years of evolution, we have developed this brain-blood barrier, um, which kind of block out what's mainly in the blood from our brain, so that foreign substances cannot go to our brain that easy. But once there's like an impact on that, this barrier can be broken, and immune cells and foreign molecules can enter, and these are will be considered as invaders by the resident immune cells in the brain, and that triggers inflammation. So that kind of goes hand in hand with microglia activation. Once they see these debris, foreign substances, they will release a lot of cytokines, kind of telling each other, hey, there's an invader here. We gotta expand ourselves, we gotta make ourselves active and start eating things. So um, they will become very activated and start to clean up damaged tissues, and they even overactivate so that they will damage the healthy neurons, especially in the synapse region where the neurons communicate with each other. Okay, and that actually also goes hand in hand with the autoimmune response. So after the brain injury, you got a leaky blood-brain barrier, and that exposes the proteins uh, the immune system never sees in the brain. And this can cause auto antibodies to form. What that means is that antibodies that's attacking ourself, so that attacks our own brain tissues and leads to many problems. So moving on, what are some treatments for neuroinflammation? The classic one is the anti-inflammatory medications, such as the corticosteroids. An example of that is dexamethasone. Um, the advantage of these medications is that they reduce inflammations rather quickly, but they can cause all sorts of potential side effects. In fact, one of my first research study in college was trying to use an alternative than corticosteroids in the brain tumor models because corticosteroids can lead to all sorts of different problems. The immediate ones can be just like nausea, feeling uncomfortable. In the long terms, they actually also interact with the medications to make medications less effective, and they will also cause long-term problems by just because a steroid is lipid-based and it's really hard to get out of our system. So making the steroids in state, keeping it in our body, will lead to many side effects. So, which is why people come up with non-steroidal anti-inflammatory drugs, the NSAIDs, which is an example of that is ibuprofen. So the advantage of that is that they still reduce the inflammations without all of those potential side effects from corticosteroids, but it has limited effectiveness, especially for the brain-specific inflammation, because brain is very special in terms of the blood-brain barrier. So getting the ibuprofen from the blood into the brain, that already reduces a lot of that from happening. And and without like a steroid base that can go directly into the cells, that just limits the effectiveness. Okay, and moving on, these are some like newer drugs or alternative drugs that people are doing heavy research on. One of them is target-specific pathways. An example of that is the NLRP3 inflammasome inhibitors. So what that means is um, there are certain pathways that makes the microglia activated, but there are also pathways that's especially designed to make them overactivated. So what the scientist wants to do is to turn off those overactivated pathways, but still have some activated pathways there, so they can have the function to clear out the pathogens, but will not become hyper aggressive and starts turning on our own cells. So the main aim for that is to reduce damaging inflammations while preserving this protective immune response. And another new area of research is the targeted immune therapies. So there's anti-CD3 monoclonal antibodies. CD3 is a marker for T cells, which is a adaptive immune cells. So what happens a lot of the time is the microglia will actually tell T cells to carry out their orders to attack ourselves, our self neurons, and um, by by inhibiting those T cells, um, the therapy is aiming to reduce this inflammation as well. And actually, non-invasive delivery methods are currently doing research on. I've read this article about nasal delivery in animal models, and the efficacy, at least in the animal model, looks pretty decent. And another, last but not least, is the minocycline, which is a antibody with anti-inflammatory properties. So they've shown in studies to reduce the microglia activation, and they may also improve the cognitive recovery. But all of these are really new, and the results are really seen from model organisms like mice. The translation into human will still take decades of time. Okay, so kind of moving on to like a similar autoimmune disease, which is called the dermatomyositis, which is the inflammation of muscle and skin. The causes are mainly autoimmune, which means that our immune system is attacking our own muscle fibers and our own skin cells, so that kind of causes the muscle weakness and skin rashes, which is the typical symptom of dermatomyositis. And moving on to the causes for that, there's always the genetic cause and the environmental cause. Some environmental cause include infections and also UV exposures. So we're putting on sunscreens not only to stop us from getting skin cancer, but also stop us from having these autoimmune effect from the brain, from the skin. And there's also cancer-associated dermatomyositis. So some cancers symptom will first appear as rashes instead of cancer, which actually offers us a good way to have an early diagnosis of these aggressive tumors. Okay, so last but not least, there are many overlaps for the treatment in terms of myositis and brain inflammation, including the corticosteroids, the NSAIDs, as these overall reduces inflammation. But another big part, other than the medical therapy, is the lifestyle and supportive interventions. So nutrition such as omega-3 fatty acid, antioxidants, and just having anti-inflammatory diets will help. And exercise with a relatively good amount also helps with reducing inflammation. Actually, there's a really interesting research on why exactly exercise help, and the hypothesis that the researchers has confirmed is that we are using certain amount of energy every day, and that's kind of static in uh, that's programming us in a way. But if we're not exercising, then all of these extra energy are used on immune cells for them to, attack something. So that increases the inflammation. But if we exercise, that actually takes away our energy reserve from the inflammation, so that we will have less inflammation in our body. Okay, and then last but not least, sleep and stress management is also very important. So with that, that's all the presentations I have, and thank you for listening.
Thank you. That was so interesting. Yes. And, I love when you finish on, we have asked William and Ann, our Duke University students who've done these presentations, to not give it, not dumb it down for us, but to give it the technical language, because it's a good brain exercise for us and it helps us to learn more. But I always love when we learn something at the end, like that simple things like lifestyle things that we can do, like nutrition and exercise and sleep, to reduce inflammation. So thank you so much.
Mm-mm.
Thank you, William.